Owasso first responders and medical personnel trained today in the event of a mass shooting. It included Tulsa Tech students, staff at Ascension St. John and other Owasso agencies. Healthcare providers say the simulation training isn't a matter of if it will be used, but when. 2 News Oklahoma's Shay Smith was at that training and has the details.
Responders and Ascension St. John healthcare workers in Owasso went through mass casualty incident training today. Nursing students at Tulsa Tech acted as the victims, and the healthcare workers here at St. John had to learn how to deal with such a large number of patients.
Unfortunately, we are living in a time where these situations are occurring all too readily and too commonly.
It was the first of its kind training for Owasso.
Immediate response after the St. Francis incident was we did some internal drills in which we tested our own capabilities to handle a similar event.
Hospital staff went through the simulation of a mass shooting incident with Tulsa Tech nursing students playing the victims.
It was a gunshot wound victim, gunshot wound to the hand.
First responders showed up to Tulsa Tech's Owasso campus and evaluated several gunshot victims, then took them to Ascension St. John in Owasso, where staff trained on how to handle multiple shooting victims.
It's a matter of triage, so that was one of the first things that we did was set up the triage staging center so our emergency department staff could quickly identify who's in need of the most care.
Even as medical staff trained, the hospital continued receiving actual patients. Hockmeyer says that also helped during the training.
One of the challenges was we have real patients here in the hospital. We didn't shut down the hospital for the purpose of the drill, and that's very similar to what it would be if there was a community event.
The Tulsa Tech students say although the training was for hospital staff and first responders, they learned something from it too.
It already makes me start thinking like, okay, what would my role be? How can I help in those hospital systems? Like, where do I need to get out of the way?
Tulsa Tech and St. John say that this training took several weeks to plan. In Owasso, Shay Smith, 2 News Oklahoma.